that leads to our next question, which we have from our audience, is how to choose a doctor in the first place. And then what do you do if you feel like your doctor isn't the best fit for you? This came from our audience. One thing that is critical, I think, is finding a doctor who loves what they do, who is really, engaged in being a doctor, and who enjoys the fascination of taking care of each individual patient, who's different from the last one, and who's going to be there for you, who takes you seriously, who is accessible and all that. Dr. Peled, what would be your, do you have a practical approach to how to pick the best doctor in the first place? And what do you do when it's not a fit anymore?
For sure. So, for me, I think that finding someone who is on top of the latest care and innovation is incredibly important. And so one of the things that we see a lot, unfortunately, is you don't know what you don't know. So I hear from women all over the country, and they didn't know that they could have the option of nipple sparing mastectomy, or they didn't know they could have a breast reduction at the time of their lumpectomy. And it's really hard because a lot of the choices we make, they're permanent and you can't really go back and fix them. So one of the questions that I suggest people ask their doctor is, for my personal situation, my cancer, my body type, my goals, are there any advances in technology or techniques or approaches or medications that you would suggest for me? Are there clinical trials that I could participate that would allow me to get access to the latest and best care?